This is an ABC podcast.
A hot button issue for new parents: when to introduce solid foods to a baby. One school of thought is that introducing solids early helps to reduce the risk of developing food allergies. Others say breastfeeding for the first 6 months and the exclusion of solid foods is vital to a baby's development. Now, another argument for early solids, what many mothers already suspect: early introduction of solids may help babies sleep better. The person who led the research is Professor Gideon Lack from King's College London, and I put it to him that this proves that mothers know best.
You could say that, yes, and mothers have been telling us anecdotally for a long time that feeding babies early while continuing to breastfeed improves their sleep at night. There hasn't really been a large randomized controlled study to actually prove whether that's the case.
So you used basically a study designed for something else, which is the idea that if you introduce allergenic foods that are thought to cause allergy early, you might train the immune system and actually prevent allergy occurring. So this was a trial designed to look at that, but you also looked at the sleeping impact.
We did, and that, as you point out, was not the primary purpose of the study. But when you do a study like that, where you profoundly change what are current guidelines, you need to look at every aspect of health and safety in a child. So we looked at a variety of outcomes: growth, obesity, development, and sleep. So the purpose wasn't so much to prove that babies slept better in the early introduction group, in the group that received solids, but to make sure that we weren't doing anything to damage or disrupt them. And we were pleasantly surprised to see that the group of babies who started solids after 12 weeks of age slept significantly better.
So how much better? And just because we've jumped ahead a little bit, just so that people feel confident in the study, about 1,300 babies were divided into two groups, one of whom got introduction of solids with allergenic substances in them at 3 months, and then the other group got it at 6 months, as is usual practice in countries like Britain and Australia.
Yes, so the average sleep in the early introduction group was just over a quarter of an hour longer per night, which you might say is not a huge amount, but the number of nocturnal awakenings had also decreased. But if you multiply the 16 minutes by 7 days, you are talking about close to 2 hours of extra sleep in the early introduction group. The remarkable thing was that this difference was sustained beyond 1 year of age. So although the infants who were in the exclusively breastfed group started feeding solids, as you point out, at 6 months of age, that few-month difference profoundly altered sleep characteristics all the way up to beyond 1 year of age.
And what about the babies who were really bad sleepers and driving the parents nuts?
That number more than halved.
And was there a dose effect? Because not all mothers, I understand from your study, were able, I'm not sure why, able to adhere to the introduction of solids at 3 months. They found that hard in some of their babies. I'm not sure why.
Yes, we're currently analysing why that was the case, and a variety of factors. Babies who were born with a more substantial birth weight were able to adhere to the protocol better. Babies of different ethnicities had different durations, which was interesting. But the important thing, as you point out, is there was what we call a dose-response effect. The more babies ate, the more they slept.
And the ethnic differences?
The ethnic differences suggested that children who were of non-European origin, non-Caucasian, didn't sleep as long as the babies who were of European origin. And we can't really explain that in terms of any other factors when we look.
One of the fears of introducing solids early is that you stop breastfeeding or the baby loses interest in breast milk. Did that happen?
No, not at all, actually. And the gratifying point about the study was that at 6 months of age, in both groups, the majority of infants were continuing to breastfeed, much more than infants outside the study. And by 12 months of age, a very significant number, more than 50%, were still breastfeeding.
And could it be explained by the foods themselves rather than the solids?
Are you asking whether the type of food that we gave the baby influenced whether they slept?
Yes.
We did look because, as you pointed out earlier, adherence to the study varied. And when we looked at the type of solids, whether babies consume more dairy or more fish or more wheat, that didn't seem to affect the sleep characteristics.
Now, in Australia, when these data have appeared that it is better to introduce solids at 3 months rather than 6 months, it's almost created World War III. Paediatricians in Australia have reluctantly moved down to 4 or 5 months. I mean, are we just being too pure here?
Well, the exact age is still open to debate. I think 6 months is too late. There's definitely evidence that as of 15, 16 weeks of age, 4 months of age, it is perfectly safe to introduce solids. But the main argument for this is that this prevents the development of food allergy. And there's strong evidence that this prevents the development of peanut allergy, and moderate to good evidence that this prevents the development of egg allergy as well. Every month of delay means you miss the boat for a number of children, particularly for eggs. So if you introduce egg by 6 to 7 months of age, which a lot of parents would think, gosh, this is early, you've missed the boat. And in fact, by that age, at least half the children who are going to develop egg allergy have already developed it, and you've missed the boat, which is why our research is pointing more and more towards introduction as early as 4 months.
And just finally, the other fear that people have had is that early solids means fat babies. Is there any indication that this increases the risk of obesity?
None whatsoever. So we looked at a variety of anthropometric outcomes, length, height, weight, body mass index, as well as other parameters, and find that the lines were superimposed for growth in the two groups. We found that reassuringly in the EAT study of more than 1,300 babies. We found very similar findings in the LEAP study where we introduced peanuts as young as 4 months of age. And again, we published that data showing no difference whatsoever in growth parameters. We also looked at other factors as well, such as rates of infection, other general health measures, and couldn't find any difference at all.
Including developmental milestones?
Developmental milestones in general, so we didn't find a higher rate of developmental problems, but in fairness, we did not do detailed developmental assessments in the study. The main reason being, although we had an interest in doing so, is when you enroll babies in these studies, there's a limit to how much information you can ask the parents, because this is all extremely time-consuming, all these assessments.
Fascinating findings, Gideon Lack. Thank you very much for joining us.
It's a great pleasure.
Gideon Lack, who's Professor of Paediatric Allergy at Evelina Children's Hospital, King's College London.